Okay, I'm at first here. I'm getting ready to administer oxygen to my patients, so I'm going to check the doctor's orders. And I'm looking forward to see how many liters per minute oxygen I'm supposed to use. And I'm also, and it says we have 2 liters via nasal cannula. And I'm also looking to see the device. So I looked at the liters device. And then, of course, if it was an emergency, I'd place him without checking the orders. So I got all of my equipment here, my different types of masks. I have a simple face mask, which is this. I have a face tint, which is mask right here. This is a non-rebreather mask. There's also some partial rebreathers, but this one has a non-rebreather mask with a one-way valve. And also, this is called a Venturi mask, which you have the different percent oxygens on here. And we have the oxygen flow meter that's stuck into the head wall plate for the oxygen source. And we also have 2x2 gauze for the patient's ear, and alcohol and nail polish remover in case we have to do a O2. We have our pulse oximeter and a humidifier. So all my equipment is gathered. So I'm going to wash my hands, and I'm getting ready to go into my patient's room. So I'm going to knock on the door. Nursing! Good afternoon, I'm Mrs. Kyle, and I'm going to be your nurse today. And can you please tell me your name and date of birth? Mr. Pierce? Okay, Mr. Pierce, and what's your date of birth? 10/3/1960. Also, and you're not allergic to anything, just penicillin. Alright, so I'm going to put my bed up to working height. Mr. Pierce, you need to have oxygen. Do you understand what oxygen is for? Well, what happens is your cells, you're not getting oxygen to your tissue. So I noticed you were getting a little blue around the lips, so we have to put to make sure you get oxygen to your tissue so you get normal skin color, and also that your skin will feel nice and warm instead of cold. And we want to make sure that you get, once you get oxygen, that carbon dioxide is released from your system. So that's why we're putting oxygen on you today. Okay, I'm going to actually assess your lung sounds, and I'm going to clean off my stethoscope again before I put it on, and maybe clean off the earpieces to make sure it's ready. And make sure I clean off my diaphragm and my stethoscope. And I'm going to assess the patient's respiratory rate. So I'm looking at I'm checking your pulse, Mr. Pierce, and at the same time, actually, I'm feeling for his respirations. And so his respirations are 14, and I did it 30 seconds, and times that by 2. Okay, I looked at the respiratory rate, and I'm also looking, he's breathing, his chest is rising and falling evenly, and he's breathing unlabored, so I'm looking at the rhythm. So he's regular rhythm, and he's breathing deeply, so he's taking some deep breaths. Also, I want to make sure that I'm going to check his color. Like I said, he had some blueness around his lips. His body feels kind of cool. So we're going to make sure the natural of the body he's supposed to feel nice and warm. And I'm going to check capillary refill to see if he's getting oxygenation to his tissue. Okay. And now I'm going to check breath sounds. I'm going to check the breath sounds that are right. I'm going to have Mr. Pierce, I want you to take a deep breath in and out through your mouth. So I'm going to listen right above his lungs, right above his clavicles. The lungs go up about 1 inch above the clavicles. So I'm going to listen here. So if you take a deep breath in and out through your mouth. Okay. On the other side, I'm going to compare one side against the other. I'm going to listen down here further. Okay, underneath the clavicles. Okay, again, deep breath again. The reason why we take deep breaths in and out through your mouth so we'll be able to hear. Also, I'm going to go up underneath, pulling privacy curtains. I'm going to go underneath his gown and listen to around his side here. Take a deep breath, in and out. And the other side too. I never want to listen over clothing because you won't be able to hear the sounds. You'll hear like a rubbing sound of the clothes. Okay, also, I'm going to have him turn over on his side, and I'm going to listen to the lungs and back. You want to take a deep breath in and out. I'm going to go follow the pattern of the scapula. Okay, so take a breath in and out. I'm going to listen to about comparing each side. Okay, I'm going to listen under here again. Listen to his lungs, okay? All right, Mr. Parrish, your lung sounds are clear bilaterally to auscultation, because I listened to your lung sounds. Okay, but you're also going to, because you need the oxygen, first of all, we're going to assess your nares. Could you take a nice deep breath and blow it out through your nose? On the other side, okay. I'm going to check, alternate each nostril to see if which nostril, to make sure we got good air exchange both nostrils, because otherwise the oxygen won't blow into the nostril correctly. And we're also going to look behind the ears to make sure you don't have any skin breakdown, because oxygen puts pressure on the skin tissue and you can cause breakdown. Alright, we have what's here. We have a flow meter, so it's attached to the oxygen source. This is a wall plate and it goes into the wall. And so we already attached our flow meter here. And this knob here adjusts the liters of flow per minute. So my doctor's orders had 2 liters per minute. So I'm going to adjust this where the ball sits on the line, and it says the line is right across the middle of the little ball sitting there. And then I'm going to make sure I put on what we call a Christmas tree. And the reason we call this a Christmas tree is because we want to make sure with the Christmas tree, when it stands upside down like this, it's going to look like a Christmas tree. So we're going to make sure we put this Christmas tree on to be able to attach the tubing, oxygen tubing, to the Christmas tree. Okay, so now we got the equipment assembled, and if the patient has over 2 liters of oxygen, then what we're going to do is we're going to use a humidifier. Now this is a humidifier. It gets attached by screwing on just like the Christmas tree. Righty-tighty, lefty-loosey, so we're going to screw it onto this, and you'll see some fluctuation of bubbles in this can. This is done because oxygen above 2 liters is very drying, and it dries the patient's mucous membranes out and then helps get moisture, because the normal purpose of the upper airway is to provide moisture into the respiratory tract. Okay, so once we got this on, we're going to make sure we put the patient's oxygen on. I'll show you how to put the cannula on first. This is a nasal cannula. It has 2 prongs. It gets attached to, when the oxygen flow meter is on, it gets attached right here like this to the oxygen flow meter. This actually goes, the cannula, the prongs point downward, so they point down like this, and you put them into the patient's nostrils, and you make sure you put the tubing around the patient's ear, and then you tighten this up around the patient's neck. And you don't want it too loose, because what happens is if it's too loose, it'll come out like this, and then the oxygen is not blowing into patient's nares. Okay, and then we have, to protect their skin, we can also put a couple of 2x2 gauze around the tubing and stick it around the patient's ear, and it will help take pressure off the oxygen device off the patient's skin. Okay, so that's it for the nasal cannula. Then we have a simple face mask. So if we put the simple face mask on, the masks all go on the same way. The cannula, by the way, goes from 1 to 6 liters. The simple face mask, usually we used about 5 to 10 liters per minute. You don't want to go less than 5 liters, because what happens is the patient's CO2 can be retained. So you want to make sure you plug this into the patient. What this does is usually we put a piece of gauze in the top of the mask here, because there's a metal part, and it goes over the patient's face. And it can cause pressure on the skin. So this band actually goes around the patient's head. This goes over the patient's nose. Make sure you have a tight seal between the patient's underneath the chin and the patient knows, and make sure this is down far enough. And then if you have to tighten it, then you want to pull on the side there, and it holds the patient's tight. So that's a simple face mask. Then we have actually another one that's actually it's called a face tent, and you want to put your oxygen cord. You're going to have a little bit of different adaptation. This is for somebody that has actually very claustrophobic, so they don't want to put this on, so you want to put this goes out here instead of covering the whole face, mouth, and then it gives oxygen to kind of blow up into the patient's mouth and stuff, and it's used, like I said, it's called the face tent for those people who are claustrophobic. Then we have here this is called a non-rebreather mask. There is partial rebreather mask. Like I said, it has ports, and the ports come on the outside. If it's partially blocked up, that means you're getting partial CO2 retention, but this is a non-rebreather mask, so you're not rebreathing the CO2. It's hooked up. You want to hook it right there to the oxygen tubing. It goes on just like any other mask. It goes over the patient's head, underneath the nose, and then you pull it tight here to adjust it. This is usually, and then this bag will inflate once the oxygen. This is the only device that delivers 100% oxygen. And then last but not least, we have what's called a Venturi mask. Now the Venturi mask delivers a % of oxygen. So with the Venturi mask, this goes on the same way as any other mask. So you're going to make sure you put on and then tighten the side. This thing right here, the different colors have different percentage. This one happens to be 35%, and by looking at the bottom here, you look and it tells you what percentage. So when the doctor orders oxygen, he orders 35%. Then you put this one in here. You want to make sure you put this on. This helps keep the condensation from staying into the tubing, and also helps the CO2 goes out and it's not retained the bottom, and it comes out through here. And then of course this goes on the patient just like the other masks. So this is called a Venturi mask. Okay, we have to make sure that we're very careful that we double check the O2 equipment is set up correctly and is functioning properly before we leave the room. Also, we're going to assess the respiratory status before we leave the bedside to make sure, since we said his lips were blue, we want to make sure his lips are no longer blue. We're going to listen to his lung sounds. His lung sounds were clear, but we're going to make sure they continue to be clear. And we're going to look at the rate, rhythm, and depth of his respirations. And we're also going to check for capillary refill too as well, just like we did beforehand. So once we're done with that, there's several oxygen safety precautions we need to be aware of. The first one is we need to always have signs say oxygen is used, because if a patient gets up and moves around and stuff, and there should be no smoking at most places, but we want to make sure that no smoking is permitted in their sign up so they know oxygen is in use. Oxygen cannot be near open flames because oxygen works as a combustible and can cause the fire to spread. We also want to make sure that there's no electrical equipment around with frayed cords that can start a fire, and anybody that's using oxygen should not have any petroleum products in their nostrils. Petroleum also works with oxygen to kind of combust as a fire, so we don't want that to happen. So if anybody needs to do nose and mouth care, you need to use KY jelly as well. If they're on an oxygen tank, you want to make sure the tank, this is an oxygen tank right here, and it's make sure the stand is secure. What we have to do is make sure we turn the oxygen on, make sure the tank's full. We're going to attach right here to the bottom of the tank. We're going to attach the oxygen tubing, and of course we want to make sure it doesn't fall over, again, to be combustible, and it's safely sitting in the stand. And of course, I talked to a patient already as I was going about administering oxygen, and Mr. Pierce, when you go home and you go home on oxygen, if you get short of breath, make sure that you dial 911. You don't dial the hospital, but you dial 911. We've had several patients over years do that, and then when they need to have emergency medicine come out to their house. Also, again, like we said, breath sounds need to be monitored every 2 to 4 hours, and when the patient's on oxygen, you always want to make sure you want to monitor the pulse ox. And to be a refresher for pulse ox, we want to make sure that we clean the finger. Make sure, of course, we don't expose the patient. Make sure we clean the finger. We want to put this on, make sure the diodes are correctly lined up to each other. And we put this on, and within about 30 seconds or so, it'll read the oxygen saturation. And the normal oxygen saturation is between 95 to 100% for adults. Elderly people sometimes run between 90 and 92%. So we're going to make sure that we actually check every time they're on oxygen. We should monitor the pulse ox as well. Make sure the O2 saturation is good. Another thing we can do is we can monitor the blood gases. So we want to look at the CO2. We want to look at O2 sat, CO2, and the blood gas per the order. And we want to keep monitoring the skin, the cheekbones, around the ears and the cheekbones and stuff for any kind of pressure, because we can have skin breakdown there with the oxygen delivery system. And you have to notify the doctor if there's any problems with any oxygenation problems. Okay, Mr. Pierce, you feel okay with your oxygen? Is there anything I can do to make you comfortable? So we're going to make sure we put the bed down. Is there anything we need? Make sure I put your side rails, top two side rails up. I'm going to make sure we put the call bell in reach. So we have a call bell. If you need anything, just push the button here. So if there's anything you need, just give me a call. And we want to make sure, I'm going to wash my hands. I'm going to report the O2 sat, and that I put the patient on 2 liters of oxygen via nasal cannula to the instructor. When I'm going to document the date and time the oxygen therapy was initiated. And I'm going to make sure I document that I put O2 2 liters via nasal cannula, and I'm going to document his vital sign, and his O2 sat was 95, and his breath sounds were clear to auscultation, and his skin, it was cool and pale. At first he had blueness around his lips, and then his skin became warm and it became dry. And then his respiratory rate, rhythm, and depth was within normal limits, applying oxygen.